having to be woven into the new design of the new programs. For those of us that have been on difficulty of care for quite some time and non-taxable, this has been a bit confusing. I just heard about it, and I didn't hear about it from my sources that I was hoping to hear about it from. So I'm hoping that it can be a first item of topic.
Hey, Cheryl, thanks for that. This is Danny with HICPUF. We'll be doing a brief overview of the difficulty of care resources that are available. I am curious, how did you hear about difficulty of care? I'm curious if there
I have been involved in the difficulty of care non-tax exemption federally for quite some time, as soon as it was rolled out. But it was not told to me by anybody other than a case manager through TRE. Today, I heard about it through Kurt this morning in my conversation with him. Otherwise, it was crickets everywhere else.
Okay. Thanks for that. That's some helpful context, and we'll make sure to include information about where you should be hearing about difficulty of care updates from when we get into that topic here shortly.
I appreciate that. Thank you.
Hi there. I got a quick question. I'm over here from Developmental Pathways. And so our CDOS team as well. Is this okay to talk, or are we saving this for? I noticed you brought up the difficulty of care, so wanted to see if I could still continue going. Sorry if I.
Go ahead.
Okay. Cool. Perfect. So our team is our CDOS team is just noticing that for the PPL, we've just noticed that we've been seeing them telling CMs, members, and authorized reps that certain things are our responsibility, like the CMA's responsibility, when it isn't. So, for example, who updates the authorized rep in the portal, how to update that, changing attendance. Is there any document that you guys have that kind of outlines maybe roles and responsibilities for CMA agencies versus maybe what's in the FMS portals?
Yeah, thank you. Good question. So there's a couple different places where that information can be found. We have our general case management responsibilities as far as CDAS goes that are outlined in our regulations in 8.7515. And then each of our FMS vendors have, I'm gonna slew the term here, but they basically have case manager guides that talk about case management functionality within the systems, within each of their respective systems. So each FMS can probably speak to that a little bit better. But it sounds like you have some pretty specific instances where this is occurring. And so I think I'd like to hear a little bit more about that. And so I would invite you to come to our breakout room with the FMS vendors here later on in the meeting, and we can get some more information about where there's confusion and maybe just some miscommunication. So hopefully we can get that cleared up.
Okay, perfect. Thank you so much.
Yeah, thank you.
Hey there, everyone. My apologies. I'm having some connection issues here. So I'm listening in, and Bobby, I'm going to have to let you run a little bit here with it, okay?
Okay. I can do that.
All right.
Is there anything else we want to mention in open forum? And I'm taking notes just so that everybody knows. We will discuss it in our follow-up meeting. And if we can, we will take care of some of these things in the next month or two. And someone has their hand up.
Bobby.
Go ahead and speak, because I can't read who it is.
Okay. I just wanted to launch the new attendee poll really quick before we get started. So I'm McKenna. I'm a social work intern with the participant directed programs. This year I will be launching the poll for the new attendees. So let me launch that. If you are online, you can find the poll located at the bottom of your screen, or under the three dots that has, or the more button that has three dots. This poll will help us get to know you as a new stakeholder, and make sure that you're captured in the attendance and voting rights document. So I'll leave that up for a few minutes, and then I'll close it.
This is Cheryl Hargett Dorset. I have a question for those of us who are not on the computer. How do we do this?
Carol, you're not a new person, so you don't need to worry about it.
Okay, thank you.
You're welcome. Jessica, you have your hand up, and I noticed Amanda has her hand up. So, ladies, I don't care which one goes first. Just be kind, and the next one go after the first one is finished.
Let's fight to the first, Jessica. I just wanted to, I know Cheryl was asking for on the phone, and also if you're new and on the phone, if you just want to unmute yourself and state your name, that's also a way we can capture your attendance. But outside of that, I did just want to mention it's within our open forum, we have a nurse assessor office hours reminder. So I just wanted to plug our office hour reminder. We actually had one today. It was this morning from 11 to noon. The next nurse assessor office hours is on November 4th. Also from 11 to noon, I am going to put into the chat the registration for the Zoom session. And then once we have our materials together, if other folks that are on the phone would like this information, happy to send that to you as well. And thanks.
This is Jessica. I had my hand raised. I don't need to share anymore. Danny covered it. And thanks,
Yay.
Amanda, for calling out the folks that are calling into the meeting. If you haven't identified yourself already, go ahead and come off of mute, give us your name, and we can log that for the attendance.
This
Thank
is
you for that,
Cheryl
Jess.
Hargett Dorset. I just want to make sure I'm accounted for.
Yep. Wrote you
Thank you.
down.
Thank you.
Renee Farmer.
Thanks, Renee. We got you too. And this is Danny Kraus with HICPUF. I wanted to add a final note for open forum if that's still open.
Go ahead. I haven't closed it yet.
Okay, great. Thanks, Bobby. I just wanted to put a reminder out and an advertisement for those of you who have not already heard. We do have our overspending protocol work group starting next week. So our first meeting of 2 meetings is going to be next Wednesday, October 29th from 1 p.m. to 3 p.m. There was an interest form that was sent out for anybody to request interest for the work group. I'm going to go ahead and put the form in the chat in case there's anybody else who's interested in participating. The work group is essentially to discuss the updates to the overspending protocol where members will be permitted to spend over 130% of their monthly allocation amount with reserves. So we'll be talking about the updates to the utilization management protocol for CDAS, as well as what that exception process is going to look like. So again, the first meeting is October 29th from 1 p.m. to 3 p.m. I did send information about this through the mail following last month's meeting, so hopefully the individuals who are signed up for our snail mail received that information. I don't believe I've received any voicemails about interest, but if there's anybody who's unable to complete the form and would like to participate, if you'd like to share your name now, I can make sure to get you the information for the meeting.
Hi, it's Julie. Can you get me on the list, please? Julie Lawson.
Yes, Julie, I think I have you.
Okay. I didn't see a meeting request on it. I had heard it was the 20. When did you say the 29th? Yeah, but I didn't see an invite on it. So
Thank you. Yes, I sent
thanks.
an email on Friday with
Oh,
the
Friday?
meeting materials, but I don't believe I sent the actual meeting invitation, so I will make sure to get that out to you promptly.
Okay, great. Thank you.
This is Cheryl Hargett said I'd like to participate in this meeting, but you'll have to get me snail mail.
Absolutely. I will do everything I can to get the materials in the mail by today, and I'll make sure to get you added to our list so I can get you the meeting information as well.
I appreciate that. Thank you.
Hi, Danny. This is Jim Boyce. I think I signed up, but I haven't seen anything on that.
Thanks for letting me know, Jim. I will check the responses and make sure I can get that out. And I see people putting emails in the chat as well. Okay, so Jim Boyce, I'm writing you down. I see Thomas Keller. And I think that's Erica Falcone.
Hey, Danny, we also have another one in the chat right above Mayella with like an email as well.
Thank you. Ayala, I don't know if I have your contact information. So if you'd like to fill out the Google form and provide your contact information, that'll be the best way for me to get that out to you.
Okay, does anything else need to be mentioned in open forum? This will be the last call for this open forum. One, two, three. Open forum is now closed. Okay, the next topic is nurse assessor hour reminder, but is there anything else needs to be said other than what was said in open forum?
Hey, Bobby, it's Amanda. No, we covered that nurse assessor office hours reminder, and Danny just went over the overspending work group. So we're moving on. We're on the CDAS advertising for staff.
Okay, that is me. Somebody watch me for time because I believe we just put 10 to 15 minutes on the agenda, correct?
Yep, we have 20 minutes for you, Bobby, and I'll make sure to time check just in case you need it.
Okay, thank you. I wanted to present techniques on advertising for staff because in the almost 10 years I have been on CDAS, things have changed a lot with technology, especially because in those 10 years we had the pandemic happen. So that changed how we advertise tremendously. When I first started with CDAS, my best bet for getting staff was going to colleges and asking the nurse program if I could advertise, and now I still go to the nursing programs around town and see you. The other nursing program I use is the one at Front Range, but now they want your ads done on their web pages for job postings. And so that has a different setup. You have to get your ads approved by the departments at the schools before they go online. And the other one that I have done a lot is posted in libraries, and they have changed their setup also. They will still let you post on the boards in the library, but they also ask you to do the addition and put your ad up online, which again requires approval before it goes up online. So when I write up my ad for advertisement, I specifically state what my personal needs are, like I need help transferring sometimes, and so that requires the person knowing how to properly use a gate belt or a Hoyer lift. And so in my ad, I have things specifically stated to me. For example, that is the gate belt training, and needs that I have for assistance in dressing, because for me personally, where I have the most difficulty is the bottom half portion of my body. So that is where I need the most assistance. For example, getting pants on, shoes on, things like that. So I have on my specific ad that goes out, I have a picture of myself because I want to be open, and hopefully my people that I'm hiring will not be as stressed if they see a picture of me in the ad and then they see the list of things that I require for my attendance, including the training that I will be teaching them. If I do not see it on a portal, for example, the work group that I believe policy and finance does for career attendance, that web page has specific trainings that are specific to PCAs and CNAs. And so if I notice that that attendant that I'm interviewing has gone through those trainings, I do not spend my energy doing those personal trainings. I also have a section that explains how the person is paid and what the hourly rate is. And then last on my ad is my ways that they can contact me. And one is through my personal email, the other is through Facebook Messenger, because I have found that if I use a mixture of ways they can contact me, I tend to get better responses. Then the other thing I notice is if your ad is colorful and catchy, I get better responses because if your ad is catchy to the eye, especially at the library, they notice it more when they go through the ads or catch them on a a clipboard in the library. That is a quick summary of my presentation, which we will be sending out a slide deck for. I was not able to give the team my slide deck because I was having technology issues, but you will get a slide deck. If you have any questions or suggestions from your own experience, please ask them now or contact me later. It's totally up to you.
Way to go, Bobby. Hey, I'm back, you guys.
I know that Kurt has some great advice from his own experience of struggles getting attendance.
Sure.
Not to put you on the spot, but I just did.
Well, thank you very much, Bobby. So dealing with today, my advertising, I'll just share. I know other people have issues. The biggest thing I find is that people, when you advertise, you got to spread your network pretty wide. So Bobby mentioned a few. Um, I've went those routes. Sometimes they work great. Bobby's absolutely right. Colorful, catchy ads help. Good description. I tend to be a little bit more vague in the fact I want to make the phone ring or for them to give me a contact. And the idea when I place that ad is so that I get a response and I can sell myself as to why I'm a great person to work for. I think that's a valuable part of it in that I'm pretty flexible with schedules, for example. Bobby's right on regarding a Hoyer lift or description. When I need something like that, I'm pretty much need someone who can do everything. But I will say something like CNA experience or equivalent preferred, and then I will say I will train the right person. I don't want to eliminate someone who's maybe got experience but doesn't have an actual certification. So I like to make sure they notice that when they ring and give me a call, they say, hey, I got 18 years experience, but I don't officially have a CNA. So that way I'm not excluding people that otherwise might be qualified. And I think that's a key part of it is be precise enough that you give that only great people give you a call, but be also flexible enough for things like schedules negotiable or things like I even put a pay range in based on my budget with the idea that if someone maybe needs to make more per hour, maybe $30 an hour, and if they're really good, maybe you could hire them and choose to bill less on the CDOT side. So I just like to show that they have that potential to make more money if they show up on time and do what they're supposed to. And I'm willing to give them a raise. So I get a little incentives when you place your ad, can be kind of spread throughout your ad and keep it precise. And like Bobby said, leave a way for them to get a hold of you, whether it's email, whether it's messenger. I do a lot of my advertising for care.com. They do a pretty good job. There is a charge to that. next door neighbor app I use quite a bit, put an ad out there. I get an amazing response from people that live nearby me. Again, depending what you're doing. So just whatever you do when you're advertising, my experience is a lot of different venues. I love the idea. I've used Red Rocks Community College. They also have a nursing program, Bobby. I don't know if you ever used that one before, but
I
just
didn't
kind of,
know Red Rocks had a nursing program.
yep, I
So
didn't
see,
either.
I knew it was good to toss it to
Yeah.
you.
Yeah, Red Rocks has it. I know Front Range is right near my home here, so that makes it pretty easy. What I was amazed years ago is when I would go put flyers around, I looked up and found out how many CNA schools there are, little bitty schools. There are a lot of them around. Just do a quick search in your area for CNA schools. They're all looking for people that are looking to hire their CNAs coming right out of school, not just nursing homes. And I had the opportunity a few times to explain them the advantages of doing home health, working through programs like we're on. And most people don't, most of the schools don't even realize this is a really good, viable option for their CNAs coming out of school. So anyways, that's what I thought I'd share a little bit. If anyone wants to take some notes on that, and maybe Bobby, you can get a hold of me and can add that to your um, presentation you're planning on sending out. Anyone else? Anyone? Since we're on the topic, I see we got a little bit of time left here. We're looking till 1:40, so we got some time to talk about it. If anyone has any comments they want to throw in there, raise your hand or chime on in.
And Kurt, I wrote down some of your things, so I might be calling you too.
All right, feel free to do it, Bobby. I know we have a lot of experience out there, people looking for that. That seems to be the biggest issue on the program is getting good people hired. Little my background, I worked in a pretty big corporate setting years ago and ran my own business. And a lot of these techniques are pretty much the same. You just gotta get it out there, stay on top of it, and have extra people as backups. It's not a bad idea to have those extra people available so they're there when you need it. Anyone else? I don't see any hands.
Hey Kurt, I just thought of a question.
Sure.
How do you keep your backups encouraged to stay? Because I tend to lose my backups because they don't work a lot.
That's kind of an ongoing process without a doubt, everyone. Basically, I had a person who has bad back, for example. She used to do my weekend evenings. She wasn't able to do that, but she still wanted to be involved with, helping with personal care, maybe a little light housekeeping. I just told her up front, if you're available for some times, maybe some different hours, do you mind keeping you on the program? And she was happy with that. The thing is, I made a point also of at least once a week or every other week staying in touch with that person, letting them know I'm still looking to use them. And basically, it takes some interaction. You can't just leave them there and kind of out in cyberspace or out in the world. And every once in a while, I'll just make time to make sure that I can get them some hours. That way, they know I appreciate and I need them. So I think that's the biggest thing is let them know that they're back up, but it's got to be a little bit more often than once every month or two. So that seems to be working for me for the most part. And some people are great. I got some people on my staff who only work 1 day a week, and they're willing to work 1 day a week and also be the backup. So again, it takes a lot of talking and kind of being upfront with what your plan is on utilizing them down the road. And to be fair, most of my people have been with me quite a while now. Eventually, the longer they're here, the more hours they get, and that works out good too. So they see that opportunity. I think that's a big thing, but opportunity is a big part of it. And of course, we have to understand that they have a life and family, so maybe they need more hours someplace else. So I would try to spread that word that there's good options out there. Maybe they can find other people on the program. So Yeah, it's tough. Keeping people as backups is tough. There's no ways about it. But anyone else out there? All right, well, I think we're about done, and I see our next scheduled item, Bill Bobby, is difficulty of care resources. I did see that memo on the agenda earlier. Um, Danny, Jessica, Amanda, are we ready to talk about that?
I believe so, Kurt. We're
Well, let's
ready.
go for let's
All
go
right.
for it.
Great, thank you. Hi everyone, it's Danny with HIGPUF. So we'll just go ahead and jump into difficulty of care resources, just drawing attention to the agenda that this is a 5-minute topic, and as such, I don't have a plethora of information to share with you. So I'll just recap some of the information that's already been provided and then let you know where you can find more information. So we do have our informational memo 25-018. It was sent out in the snail mail, so Cheryl, you should be getting that very soon. My apologies, you haven't seen it already, but that should have gone out to you and should be received very soon. The informational memo basically outlines what difficulty of care payments are, which is essentially a tax credit for living caregivers that was available was available to individuals receiving IHSS and CDAS through HCBS waivers. Once services started transitioning to CFC, there has not been approval issued yet for difficulty of care payments to qualify for CFC services. The Community First Choice team has requested permission from the IRS to allow difficulty of care for Community First Choice. They are expecting to get a response here in November. Unfortunately, we don't have any new updates or any new information, but they are still hoping for that ruling next month and have been informed that the attorney assigned to the request is still working through this. We know that there are some questions about if living caregivers have concerns about their MAGI Medicaid eligibility. And as such, the CFC team and the Medicaid eligibility team really recommend that members stay on waivers to ensure that their caregivers can continue to be MAGI Medicaid eligible. In the meantime, and until we get more information from the IRS, financial management services contractors are notifying impacted members and attendants. I believe that notification is happening 1 month prior to the change to give some notice. Our FMS vendors can speak up on that if I'm misspeaking. And then if there's additional questions or concerns about difficulty of care payments, they can be directed to our Community First Choice team. And so I will put their email in the chat for those of you who are on the phone. I actually don't have a phone number for the Community First Choice team, but I can read their email off or give you our team's phone number and we can direct your questions to them. So if you are interested in emailing the Community First Choice team, their email is hcpf_cfc@state.co.us. And if you need to call them, you can call our team and we'll pass it on to them. Our phone number is 303-866-5638. And I will put the link to the informational memo here in the chat for anybody interested, as well as the Community First Choice team's email address. And that is about, those are the only updates I have right now.
Hey, Jenny, would you mind repeating those email address and phone number for those that are not online, just so they can get one more chance to write it down?
Absolutely, Kurt. So once again, that email address is HCPF, so HCPF_CFC@state.co.us. And if you would like to call, you can call our team and we'll pass the message on. And our phone number is 303-866-5638.
Thanks, thank you, Danny. Hey, I see Jessica, you have your hand raised.
I do. Thanks, Kurt. Jessica here, contract specialist for participant-directed programs. I know we have about 5 minutes because we're a little ahead of schedule. So I just want to ask a representative from each of the FMS to confirm or correct what Danny had just mentioned regarding the notification process for DOC. So if we could have someone from PPL and PALCO share, that would be great.
Hi, yeah, this is Savannah Gentry from Palco. I'd be happy to help. Yes, we do send out the confirmations 1 month prior, or the month prior to you switching over to CFC, so 30 days before.
So Savannah, are you sending them out to the employees?
It goes to the employer on the account, and then anyone that is on our mail list, we send that in the mail to the employer's address, and then everyone else receives it in their email.
Yeah, I just want to mention it to everyone that this is the employee's responsibility for regarding their difficulty of care, although I do understand sending it to the employer. So everyone out there, make sure your folks, you probably know they're already difficulty of care since they live there. Make sure you let everyone know that this is a potential change coming down the road. Thanks, Savannah. How about folks at PPL? How are you guys doing?
Hey, Kurt, how you doing today? I'm doing good, but yeah, very similar to what Palco does. We send it out to the member and the employee 30 days in advance, and we send out emails, and anybody that we didn't have an email for, we send it out in the snail mail, as Jessica referenced, or Danny referenced.
Excellent. Thanks, Dan. And anyone out there, just keep in mind, remind your caregivers, attendants. It will come in email. I know that was an issue regarding opting in and out of the difficulty or the Colorado Secure Savings, for example. But make sure to keep an eye on your emails. We are real employers, and follow up with your employees as well. All right. And then I think I've heard, Danny, you mentioned, I know that just for everyone else's information, I do a lot of follow up on this difficulty of care. Again, and I'm going to start off by saying I'm certainly not a tax advisor or anything like that. But I've heard that because this program through CFC offers the same services as it does through the traditional HCBS waiver, that the IRS has approved it in other states, and they're anticipating that approval, although that's not guaranteed at this time. And Jessica, if I remember, they said it might be retroactive. I think we're hoping for a response by November, right? I think that's what we're hoping for.
Yep, they are hoping for a response in November.
Right.
And so hopefully less than a month away, we'll have some information. And then once HCPF has additional information, they'll definitely be sending communication out to stakeholders, probably in the form of a memo would be my guess. And then just to add on to what Kurt was saying, with difficulty of care payments, and just a reminder for any employers out there, the best thing you can do to stay on top of credits or tax credits or exemptions is to consult with a tax advisor for guidance. The IRS also puts out information about difficulty of care, and that can be helpful information as well.
And I'm just going to throw a link out there. Consumer Direct has in their manual, back in Section 8, a lot of new information, including a link right to the IRS website regarding difficulty of care, the rule and how that works, as well as some new things that are coming down with the new CFC waiver. I don't know if now's the right time to talk about it, but keep your eye out and ears out for people transitioning onto CFC, because there are some new rules coming down the road that actually are beneficial, I think, for most people for the most part. So, all right.
Thanks,
All
Kurt.
right.
And
You
I'm just
bet.
going to read out something Jessica put in the chat really quickly. Each FMS vendor also has a difficulty of care FAQ posted on their website. I cannot recall the month of PDPPC, but I do believe we also mailed the FAQs out to PDPPC participants as well. I'd have to double check to see what month that is. But yes, if you are working with an FMS and you need access to the FAQ, you can find it on their website, or I'm sure you can contact their customer service and they can mail it to you as well.
Awesome. Well, we're kind of at that point right now where we're meeting the chat review to make sure everyone has got their comments or questions in there. And Amanda, I think you're kind of heading that up, right?
I sure am, Kurt. Thank you. And yes, we are on top of the chat. I would just want to plug that anyone that put your email into the address, or excuse me, your email address into the chat, just want to confirm that Danny has seen those and that we're taking those back for that work group. And then the only other comments we had was what Danny called out. So I think we're good to move on, Kurt. And if you don't mind, I'm actually next on the agenda, so I could just keep rambling.
Yeah, keep on going for
Cheryl,
it. You're the
Cheryl Hargett Dorset here. I have a question on this difficulty of care matter.
Yeah, before I go, I'll let you go ahead, Cheryl. Yeah.
Appreciate that. So I have had this implemented since it was federally approved, and my tax preparer has basically said no worries for many years. Do I need to readdress this with him?
I would definitely consult with your tax preparer to find out what they recommend for this upcoming tax year. With the service methodology changing from being available under the HCBS waivers, CDAS being available under the HCBS waivers, to now CDAS being available through Community First Choice. As a state, we haven't gotten approval from the IRS yet to allow difficulty of care exemptions for CFC. So I would definitely consult with your tax preparer to find out how that might impact you.
And Cheryl, I got a quick comment, Cheryl. When is the end of your certification period?
The end?
What's the end date?
Start date is June 1st. So he's barely into his new fiscal year.
All right, so June 1st, he would still be on the regular LTSS waiver, I believe. So with that said, this calendar year, again, not a tax advisor, you are under the difficulty of care because you still do qualify under the LTSS HCBS waivers. It's not until you transition over to the CFC that would even apply. So hopefully by the time that all happens, we have an answer where they will allow that difficulty of care moving forward on the CFC waiver. So
thank you. Thank you for that answer. That covered the broad stroke. Thanks.
Great. Patricia, I see you have your hand up. Patricia Martinez, and I see you are muted. So there you go.
I came up. There I am. You may have answered this, but I didn't catch it. So if we're on a waiver, can we choose to stay on the waiver and not do CFC at all? Or at our next when we redo our paperwork, we're gonna have to go CFC, but we can still keep the waiver?
This is with HCPUP. I can answer that if you would like, Kurt.
Yeah, go ahead.
Okay. So that's a really good question, Patricia. So as a waiver participant, you can remain on your waiver. So you can continue to receive waiver services. What's going to change though is that CDAS as a service is no longer available under the waivers. And so if you wish to continue receiving CDAS, you'll need to receive it through Community First Choice. You can receive your waiver and Community First Choice at the same time. So you don't have to give up any of your other services. But you will need to receive the service through Community First Choice once you hit that certification period renewal.
Okay, so then at that point, that's when we'll lose the difficulty difficulty of care status then?
And that's a
Correct.
definite maybe. That's how
Maybe, a definite maybe, okay.
And I believe, and I've done some research on it. I know California already has got it approved several months ahead of time. So the statement I was saying earlier is because everything is the same, nothing has changed, we still fall under that rule is what I believe is going to happen. So again,
Okay.
Stay tuned from the legal people who give you the actual answers.
Okay.
I'm optimistic. Mine does not end until the end of March next year. So next year I'll be worried about, but right now I'm feeling happy with where I'm at.
Okay.
Kurt,
Thank
this is Cheryl again. Will our case managers have knowledge of this?
Case
I don't think.
managers will receive the memo, so they'll have access to the operational memo. It's not as in their purview though to have a comprehensive understanding of difficulty of care. So I would encourage you to work with your FMS provider to get questions about difficulty of care and CDAS specifically answered.
Great. And
Okay,
I'll just throw
thank-
out there that I just want to throw out that we are technically the employers of record. And this information for difficulty of care is for your employees. This is something they need to address. This is something they choose to put on when they apply for a job. And this is something that they would do when they apply. And it has to be done every year with the FMS's help. This is through you as the employer. So this is really the employee's responsibility to deal with. So yeah, the case managers are probably not going to have a lot of purview on how to give that direction. So. And and maybe this is a good time. I know we're starting to run into we're still in that chat review here. We got just a minute. Is Kathy, are you here? Is someone from Consumer Direct here on the phone that could help me out here? There are some changes and improvements. For example, with CFC, the 40-hour rule goes away. Maybe you want to share some of the changes that are coming down the pike for people transitioning over.
Yeah, I think that one is a big one that people are excited about. So once you transition into community first choice, that family 40-hour limit per week is removed. And it's just every caregiver can work up to 16 hours a day. The only important thing to remember is it's across multiple members. So if you have an attendant caring for 2 different people, it's still that 16-hour day max. But that is something that a lot of people are really excited about. I'm trying to think of any other big ones.
I think there's something regarding overtime and ability to sign off a waiver that you do not want overtime if you live with a person. Isn't there something like that coming down, Kathy?
That might be an FMS question to be sure. I think right now, I don't want to speak on Palco and PPL's behalf. I think it's choosing whether or not to have the OT if it's over 40 hours or over 40 hours in a week or over 12 hours in a day.
Yeah, and for those who don't understand that, the good news is family can now get paid more than 40 hours in a 7-day work week once you are on the CFC waiver. However, Colorado law and state law and federal law require you to pay time and a half, and it automatically happens. So if you decide to start doing that, that's great, but it's going to mess up your allocation if you're not paying attention to it. Danny, I see your hand raised. What do you got?
Yeah, I just wanted to add to that. Thanks for clarifying the FLSA for the state of Colorado with overtime. Just wanted to clarify though that if you have employees that are working overtime, it's actually not optional to pay that overtime rate. So just wanted to clarify that, but Kurt is absolutely correct that if you have living caregivers that are working over 40 hours a week or 12 hours in a single day, they will be qualifying for overtime. And under CDAS, that's not something that we've seen quite as often since we've historically had that 40-hour week limit for family members.
And I'm going to ask the FMSs to clarify. I believe under the Department of Labor law that people who live with there as a matter of that can in fact waive their overtime under written documentation. But I know there's some special steps that have to go through the DOC, and I'm not sure how that would necessarily apply here. but then we'll take it offline later. I want to talk about overtime. Jessica, I see you have your hand raised.
Yeah, Kurt, I just want to do a quick time check because we blew past the ahead of schedule we were at, and now we've come to the breakout room time. So if we could maybe close this out, give, well, let me just ask. I think there might have been a slight adjustment to the agenda. Do we have a physician's attestation for children update, or is that something we'll need to do next month?
Hey, Jessica and everyone, it's Amanda again. Yes, so this was a mistake on my part. I apologize to the group. I was hoping to have updates for you all by this PDPPC for the physician's attestation, but I do not have updates. So apologies that I did not remove it from the agenda, but this agenda was sent out before I could change it. So just wanted to briefly mention no updates, so we can go ahead and jump into breakout rooms.
Great. We're right back on schedule. Thanks, Jessica, for keeping us in line there. Appreciate it. All right. I guess we're ready for breakout rooms.
All right. Hey, everyone. It's McKenna. I'm going to be opening the breakout rooms. You can find them through your menu and click on breakout rooms. If you need help getting in or if you're calling into the meeting, just hang back in this main room and then we will help you.
All right. So great breakout rooms. If anyone wants to report anything as far as anything coming out of their meetings, feel free to step up and share. If not, that's okay too. Hey, Jessica.
Yeah, thanks, Kurt. Hi, everyone. Again, Jessica Currell, contract specialist with participant-directed programs. We had a good conversation in the FMS training and case management breakout room. A majority of the conversation was around clarifying the case manager role as it relates to getting authorized representatives updated and changed in the FMS systems, as well as addressing paperwork and that kind of thing. So those responsibilities are outlined in rule, and you can also contact the FMS to get more information about the finer details of their processes. Essentially, getting an AR updated or assigned begins with the case manager having that AR get trained with Consumer Direct and then referred over to the FMS of choice. So hopefully that is helpful information, and PPL and PALCO are available to support case managers and their agencies with some of that finer detail. And then another question that came up was about peak and some difficulties with that website. So I think in the chat, Danny threw in the technical support webpage. There's a chat bot that you can interact with. You can also email, but then there's also a phone number for those of you who would like to call. It's 800-250-7741. And I'll throw in there, sorry about the lack of a 5-minute warning message. That was so helpful last month. McKenna did great to get that out for everyone. I didn't assign her host duties, so I hogged that and didn't allow her to get it out. So that'll happen next month and moving forward, because I know it's really helpful for those of you in the 2 other breakout rooms that we have.
Thanks, Jessica. How about for the other groups? Anyone want to speak up to what they talked about? We don't have to do that. It's up to you guys. Amanda, I see you have your hand raised.
I sure do, Kurt. Thank you. Amanda Smith again. Just wanted to report out for our in-home support services, IHSS breakout room. Wonderful conversation as always. First time we haven't gone over, so I just wanted to announce that. That's very exciting for me. But had lots of conversation about what we're seeing with Nurse Assessor as it relates to IHSS. Just reminders on going to those office hours, different processes, and things like that. So Just again, a plug for recommending check out our nurse assessor website for all things going on nurse assessor and to attend the office hours. Thanks, Kurt.
All right, great. Bryce, do you want to throw anything what we were talking about in our group? I mean, it is kind of a private group, but and then I'll just share. We primarily talked a lot about Tabor and the cuts coming down and kind of how that happened. Colorado Cross Disability Coalition had their state meetings this last Thursday and Friday, and it was very eye-opening on how Tabor actually works and the reason and how the state got in its deficit situation when you wonder how that happens when you have to run a balanced budget. And Reader's Digest version is that the H-1B bill that a lot of people did like, although a lot of people dislike, took effect and effectively cut the projected income from the state 5 days after they proposed and passed the budget. So now those budgets have went to the point where they'll be negative, and this executive order by the governor said we had to cut Medicaid or we had to cut state programs. Literally, we are about $1 billion in the hole. That's B, not an M. And that's why we got a 1.6% decrease. And Tabor's a part of that, although Tabor, for a lot of people, feel it's good. It has no contingency for those budget deficits when there's a sudden change for whatever the reason. So that's kind of what we talked about. So when you hear about that stuff, well, the goal is we got to have real sustainability. This is a real crisis to deal with that they got to work through until we can figure out other legislation to bring more money coming in the future years. So hold together, everyone. Make sure that we got this is real. So.
Kurt, I'd like to add that Bryce
Nathan had his hand up first.
Sorry, Bobby.
All right, Nathan.
Yeah, just real briefly, I want to interject in there, and I don't think I'm far off my rocker here, but there was discussion that you mentioned about you were confused at how we can have a deficit but get a refund on Tabor. To give some clarity, that you kind of declared it, that deficit comes not from the state choice, but by the federal cuts that come down to the state level. And then, of course, they have to pass them on. But our target, if you want to influence changing or reallocating the overages of Tabor, because Tabor was put in place so that the government doesn't just, in Colorado here, just say, well, we decide we need the money, so we're keeping it. The whole point of it was to let the people decide, can you keep it? And what are you going to use it for if you're going to keep it? And that's why they always have to declare, and generally always declare, well, we want to keep it for roads improvements. And why do they do that? Because they've tried to determine what is the most prevalent thing that all people are going to be interacting with. And that's the transportation methods, the roads and things like that. And they probably figure, well, if they can get the extra money there and they want to extract money, then they'll pull money from that budget itself and put it somewhere else, but not the allocated money from the acquired from Tabor if people vote for it. Every year, of course, people vote it down and we get the check back. So that's where it comes from. And why? It's to allow them to not, or to prevent the local government from saying, from the state government from saying, we just decide we're going to keep the money and you don't have anything to say for it. And that's what the others have done. That's not an opinion. That's just a matter of fact. Some people like the idea, some people don't. But I think that the problem comes in without clarity is that people will direct their frustration and anger and kind of try to go after the state government. But with that in mind, you're never going to get anywhere because we would have to then go in and shut down Tabor entirely and have that voting process do so. You literally are up against influence the federal outcomes as well as the others, like you had mentioned earlier, Kurt, that actually, I'm sorry, that it was the third guy in our group that mentioned about, other people not affected by our situations here and why we come to CDAS and why we work with this group. They only see one thing, which is logical, and that's their portion of the money can either go to somebody else for some other purpose they'll never see, or they can have it back. And that's not a good thing or a bad thing. I'm just objectively stating that's likely how many people do see it. And so be fair with them as well. But those are the people we have to convince and show a value for as to why they should say, let's designate it towards healthcare and roll those Tabors over, but we have to win that fight.
All right. Hey, I see Jim, I know you got your hand raised. Bryce, you got your hand raised. Go ahead, Jim.
Only thing
I'll
I
wrap up with Bryce.
was this Bryce put a good pointer to the CDC online meeting if you want to, and because I'm confused about a lot of this stuff, and that seemed like a good place for me to start going to understand it better, because I think and to figure out where I can the guy that just talked get smart on this so I can help. When I talk to people, I can tell them what, at least from my perspective, what's going on better than I'm doing right now. So anyway, Bryce, thanks for putting that online. That's a good pointer. Thank you.
All right. Thanks, Jim. How about you, Bryce?
Yeah, I think just to expand on what you just talked about, what we talked about in the group, and with Tabor, the issue comes with when you're looking at Medicaid. Medicaid's a third now of the state budget, 1/3. K through 12 is another third. Everything else fits in the final third. And Tabor is also, it's based on, I think, an algorithm related to inflation in part. And one of the biggest problems that we're having with Colorado Medicaid is that medical costs are outpacing general inflation by a factor of, I think, about 3. And so then you add the fact that Medicaid is the sole provider of long-term services and supports and or home and community-based services. What do I mean by that? I mean the community-based services that people receive in community settings where they would otherwise receive in a nursing facility. These are also not mandatory under federal and state law. These are discretionary spending items. So the programs and initiatives that enable people with disabilities to live in community settings as opposed to institutions and assisted living facilities, that is very much at stake. And what's happened to Medicaid is it's just absolutely expanded way beyond its originally intended target population. And the federal match, so Colorado for, say, people with disabilities, it's 50-50. Every state has different allocation of percentages for every Medicaid dollar spent based on per capita income and other variables. But the expansion population is 90% federal, 10% state. It used to be 100% federal. And I say that because all of the debates about Medicaid disproportionately and negatively will affect people with disabilities because we are a very small part of that population, but we have a tremendously outsized set of costs associated with us and a relatively smaller voice. So what we were also saying, I put that link in the chat for the Colorado Cross Disability Coalition. If you sign up to be a member, we send out weekly action alerts, and a lot of what's coming through the state and leading up to the legislative session this winter and spring, we will have a lot of creative financing that we're going to need to figure out, a lot of budget fights. But ultimately, I think getting everybody to the same table, understanding what's at stake, and understanding like what the constituent parts of the budget are, how things are funded, and how we can continue to get things like CDOS. That will take a village. And educating people about how Medicaid is so important and the exclusive way that people with disabilities live in community settings. You'd be surprised how little that's understood.
Right. Hey, thanks, Bryce. Amanda, I see you have raised your hand. I'm assuming we're getting back to our one last agenda topic. So is that what you got going, Amanda?
That
is, but I just wanted to thank you all for that conversation. I didn't want to interrupt. It was really good conversation, but just wanted to get us back doing a quick time check because we
All
are
right.
just about at 2:40.
All right. All right. Is Aaron here? I see HMA documentation member checklist, 225 to 235.
Yeah, Erin is here.
Woo-hoo.
However, she's not feeling great today, so I am actually going to take this over,
All right.
Kurt. So today I'll do my best Erin impression.
All right.
Though she is a well of knowledge, so I'll do my best though. So for this, we're just talking about the HMA documentation member checklist work group. We had this meeting last Wednesday, so just wanted to thank everyone that participated with providing feedback either during the meeting, and we also received feedback via email. So if in case you sent your feedback in email, just know that we did see that and we're taking that all into consideration as we're making updates, changes to the form, just kind of looking at what we've been asking of. So to give the general group a little bit more context, what we went over in that meeting is the HMA documentation guide that is used by case managers primarily as a resource for where to document HMA activities and also what qualifies something as skilled care. Additionally, with our new nurse assessor process, we also went over what we're calling the HMA documentation member checklist as a resource for members to know what things you may want to have readily available or you may have to get to be able to substantiate your HMA need. So again, just wanted to thank everyone for that feedback that we received, and we had lots of great dialogue throughout that meeting. And so we're just going to take that into consideration as we're creating these materials and getting them ready to be posted. So that information will be coming soon via a memo. Of course, right, we love our memos. So that will be coming through a memo with the materials as well for everyone to see. And that's all I had on that, Kurt. Thank you so much.
Great. Anyone have any questions? All right. Great meeting, everyone. We do have open forum scheduled here for anyone who has to add anything else they'd like to talk about in open forum. I see Jim, you got your hand raised.
Yeah, thanks, Kurt. The last speaker, I would like to formally ask that once you get that sorted out and published, that becomes an agenda to this meeting, and we go through that checklist.
Outstanding.
Jim.
Danny,
Yeah.
did you get that note? That's just Amanda. Great.
Yeah, I got that, Kurt. Thank you. Do you want to speak a little bit, maybe, Kurt, to the agenda topic submissions, things like that? I'm wondering if maybe we should go that route so that we have it documented so we could follow up and make sure we get that on there.
That really is helpful as well. And Nathan, we'll get right to you next here. What Amanda's referring to, and we do have it, I believe, is it on this agenda, but on the PDPP website for sure. You can submit any agenda topic you'd like. The sooner you do that, the better. And what we typically do then is we review that the day after today's meeting and also a little later on to make sure that we discuss that and include that as a subject. It's a little bit of a process of the form to fill out, but it includes things like, do you want to talk about this topic or what you specifically want to talk about? So, and I see Jessica just put that link in the chat as well. Don't hesitate using that, and someone will get back to you, and we'll make sure we get it on there. So just a little bit about if you have any agenda topics you want to talk about, want them on the agenda, so we take the time to research and follow up on it. Please use that form as that's probably the best way to get your get heard. All right.
Yeah, Jim, and if you could just go ahead and fill that out. Happy to review that with our co-chairs and see if we can add that to a future agenda. But thank you.
Okay, good. Thanks.
Okay. Nathan, I know you had your hand raised for a second there.
Yeah, I just had one more bit of information to add. According to that statistic that we gave, we mentioned about that Colorado matches 50%. And that in itself maybe doesn't give us a whole lot of understanding what that really means. But as it turns out, 50% is the minimum matchable. And the explanation for the amount that is determined between federal and each state is that it's based on the perceived wealth of the state. So being that we're on the minimum, believe it or not, we're grouped in there with like New York and California. I guess that's a double-edged sword, isn't it? But
Right.
whether that is true or not, but that'll just give maybe a little bit more elaboration that I guess we're perceived as one of the wealthiest states, and therefore we have the lowest match state to federal.
Per capita, you're absolutely right, Nathan.
Yeah.
We are fortunate that I just do want to share as well. Again, we're kind of lost the subject of our thing. I believe the CFC program now, however, by expanding these services to CFC, which includes children and other things, I believe the federal government has now said they're going to match 58% as opposed to 50-50. So that's kind of the transition. 8% is a lot when you look at the Medicaid state budget.
Yeah.
And then also that 50% match is to Medicaid dollars spent in the state, and facility fees represents a huge amount of that budget, a huge amount. So when you're bringing in $1 billion or $2 billion a year because of facility fees, realize in fact that effective number is closer to $4.5 or $5 billion per year that really comes right in out of the state budget. So that's a significant amount to consider. And all that money goes for the Medicaid programs. And as Bryce mentioned earlier, this is for the optional programs that Medicaid offers to our community as well as disabled people. So it's all the Medicaid people. So, all right, great talk, guys.
Suggest that maybe that perception is somewhat skewed then by what the state is including as covered services. So yeah, that's a good point you make there. Awesome.
Right. And that was a great way around the Tabor situation. And Tabor is in general, it's on the surface makes sense, but there's no allowance for enough contingency money for those big changes that happen year to year. There's no exponential smoothing. It's year to year. If you got surplus, even if you have a deficit projected the next year, you can't use it for that surplus period. It has to be voted on the next year. So you're always running a year behind. That's basically one of the issues with Tabor, although on the surface it looks pretty good. I know back in the day I voted for it, so I ain't going to say anything bad about it. But yeah, we had just changed that narrative out there so they understand that. In general, it may be good, but not for necessarily everyone. Hey, anyone else got anything more open forum topics while we're talking?
Hey, Kurt,
before we wrap up?
This is Jim again. The link that you guys put to request topics for this meeting, I clicked on it and it says it was Googled by Google Security as being a suspicious link. Have you guys had any problems with that?
I have not had problems in the past, but
And Danny, you're on Google, right?
Yeah, I clicked on the link and the Google said, you sure you want to go to this link? It's a suspicious link.
Well, when I clicked on it, it says HTTP, and it doesn't have the HTTPS, which would be the secure. So maybe that's why it's doing that. Yeah.
All right. Okay. Thanks.
all right. Anything else, anyone?
Hey, Kurt, can I give you a call after this? Are you gonna be free?
I'm not free. I'm like $100 an hour, but I'll be happy to talk to you. Yeah, you can give me a call. That'd be fine. You got my number?
Yeah.
Good. All right. Good. All right. Anyone else? Anything else? Meeting wrap up. Folks, it's been a great meeting. Just a quick reminder to everyone. Next month's meeting is the third Wednesday of the month in November. So we're not having it the day before Thanksgiving. That way you'll have time to prepare your turkey dinners the day ahead of time. And so we'll have it. And the same thing will happen in December as well. We try to do that in November and December. Do it the third Wednesday as opposed to the fourth Wednesday. So please mark your calendars accordingly. All right.
One more thing, if it's okay.
Sure.
We talked, and so you'll see the link for the peer trainer in the chat. We talked about that in our breakout room. So I just wanted to let the entire group know that if you guys have any questions about that position, we also have a couple other positions open, a training lead and a training coordinator. Both those are full-time, peer trainer is part-time. So I'll put my email in the chat if anyone has any questions about those, but please feel free to ask.
Kathy, I had a referral from a good person. It'd be good if she'd be interested.
Yeah.
I think she applied, so we can talk about that offline though.
Okay, perfect. Thank you.
All right. Anyone else? I see Jim, you have your hand raised again by chance? It's kind of hard for me to see here everyone at once. Maybe you had it up from before yet. Well, great meeting, everyone. Unless we have anything else, I want to officially ask for someone to adjourn the meeting. I need a first to adjourn the meeting and a second, and we'll call it a day and see you next month.
I officially adjourn the meeting.
I will second that. Thanks, Bobby. Everyone have a great week and enjoy the weather out there.
Thank you.
Thank you.